My name's Taylor. I'm going to be your student nurse today. Can you tell me your first and last name and date of birth, please?
Joe Smith, 10-5-54.
Perfect. I'm going to check on the bracelet, which it matches. Do you have any allergies?
Yes, sulfa.
Okay, I see that there, and I'll make note of that. I'm going to go ahead and provide for privacy. I'm going to gel my hands with pretend hand sanitizer. And then I'm going to go ahead and check provider orders, which it looks like today our provider orders are saying we're going to be placing an IV to give you some fluids. Is that okay?
Yep.
Great. Okay, I'm going to go ahead and get started. I'm going to go and gather my supplies, and I'll be right back. So I'm going to go get my supplies. I need my start kit, needle, which is a 20 gauge, my saline, and then this would be in sterile packaging, but I have lost it, so I'm going to pretend it is in sterile packaging still. Okay, so I would go ahead now and prepare my supplies. So I'd open the sterile packaging and keep it in the boat, which, like I said, this would be in sterile packaging in the real life, so I'd open it and keep it in the boat. And then I'm just going to kind of prop this open a little too to make it easier. I'm going to go ahead and prime my J-loop. Make sure there's no air bubbles. Okay, so I would pick it up sterilely and attach it. Make sure it's not locked, which is not. I'm going to prime it. And then I would place this end back in the boat so it stays sterile, but I'm going to pretend because I don't have a sterile boat to put it in. Okay, so now that that's done, I'm going to make sure that my patient's in a comfortable position. Are you comfortable?
Yes.
Great. I would also make sure that I have the correct gauge or size needle, which I do, and it matches my orders, which is a 20 gauge. Next, what I'm going to do is apply my tourniquet, which is in here. Joe Smith. I'm going to do a little squeeze. Okay. I'm going to go ahead and feel for a vein that I like, which I really like this one. So this is the one that I would do. And I would make sure that I would put the arm in a dependent position, which it is in a dependent position, and that I'm starting low and going high. So technically I'd be starting down there, but we're going to do this vein. Okay, that looks good. We're going to give his arm a little bit of a break, take the tourniquet off. I'm going to go ahead and I would have gloves. That's the one thing I forgot, was gloves. So I would need to put gloves on, but I don't have gloves. I'm going to run and grab gloves
that's okay.
super quick.
We'll just take it off the time. I know what time it is now.
Okay. Gloves. Oops. Perfect. XL gloves it
There we
is.
go. Okay. Bear with us. Oh, there's a pair of large right there above the sink, above the water.
Okay, never mind. There were gloves in here. I would have probably put those out with my supplies ahead of time so I wouldn't have to leave the area. But for the time being, I had to go grab them. So I have gloves. I'm going to take that swab. I'm going to scrub this for 30 seconds. Is there any chance you can tell me when?
Yes.
Okay, thanks. Making sure that we get it thoroughly cleaned.
Okay, we're at 10 seconds in right now. It's the longest 30.
I'm realizing while I'm scrubbing that I should have checked the expiration dates and the intactness of the packages of the supplies before I started opening them, so I would do that before I get to this step next time.
Okay, 2 seconds left.
Okay.
And we're clean.
Perfect. Okay, so I'm going to go ahead and place this where I see the vein so I remember where I'm going to go. Sorry, I just want to make sure it's pointing away from me. Okay, perfect. Now I'm going to go ahead and reapply that tourniquet. Now that that's done, I'm going to make sure they're still comfortable, which they are. I'm going to go ahead and grab my needle. Make sure that it's intact, and it is, and I already verified it's the correct size, which is a 20 gauge. Now I'm going to go ahead and pull the skin taut, and I'm going to make sure that I tell my patient you're going to feel a little poke. 1, 2, 3. I'm going to go down in at a 30-degree angle. Then I'm going to watch for return. feel like I see a little bit, maybe not. I'm gonna flatten it out. Go in a little more, and then push my catheter in until I hear a click. Which I almost hear a click. There it is. Click it. I'm gonna take the tourniquet off. I'm gonna occlude it. I'm gonna make sure that I am carefully twisting this off while continuing to occlude it. I'm going to, if I'm not seeing return, which I am now, but I wasn't a second ago, I would have redirected the needle without taking it out. But now I'm seeing the return, which is good. So I'm gonna go ahead and attach this J-loop, and I'm going to flush it with 3 to 10 mLs. And you can also pull back for a return. Then I'm gonna clamp it. And then I'm gonna go ahead, and I do not have a Tegaderm dressing, but I would put, oops, well, can I clamp it? There we go. I would put a Tegaderm dressing on it, so I'm gonna pretend this is a Tegaderm dressing, making sure that catheter kind of came out a little, which I hope it's okay to kind of push that back in. Put the Tegaderm on it, and then I would label it with the time, date, what kind of gauge I put in, and my initials. I would secure the J-loop with tape, which I can do that to make sure that it's comfortable for the client. Oh, sugar. Tape. Which tape is something I could have had ready as well, so that's definitely something I'll do better next time, is making sure I have my gloves out and the tape ready to go, which I maybe could secure that a little better, but you can put multiple pieces of tape if needed, secure it. Then I'm gonna take this off, make sure that my patient's still comfortable. I'm gonna dispose of that needle right away, so put it right in the sharps bin. I'm going to make sure the bed is low and locked, that they have their table, that they have their call light. Is there anything else I can do for you, Joe?
Nope, I'm good, thank you.
Okay, I'm gonna dispose of my gloves after I get rid of my supplies, perform hand hygiene, and the skill is complete.
Very good.
Am I okay on time?